Hi, Til Luchau here. I want to talk about preparation, a topic that gets ignored, rushed, and skipped over too often in hands-on work, in my opinion. I wrote a couple of books, Advanced Myofascial Techniques, which are techniques for specific client conditions. And at some point I realized I needed to help people contextualize or think through the sequencing or strategizing around the tools they were using. So there's a couple chapters in there about this topic. I'm going to share the one about preparation in Massage and Bodywork magazine coming up, and so I want to talk a little bit about that. Preparation we would classically think of, at least in most of our training, as a tissue-based phenomenon where we warm up the tissue or get it pliable, get ready for whatever tissue changes we think we're accomplishing. Turns out the tissue change is just part of the equation, maybe a minor part, hard to say. That's what some of the debates are about right now. But there may or be fewer, you could say it this way, there may be fewer tissue-based effects than we used to think, and a whole lot more, you could say, nervous system or experiential effects to our hands-on interventions. And there's a sense of preparation that needs to happen there too. So in the big sense, I'm going to define preparation as creating the conditions that predispose your client to whatever changes they're looking for in their work with you. Creating the conditions that predispose your client to the changes they're looking for. Preparare, the Latin root for the word, the English word prepare, has two parts. Pre, which means like the English pre, beforehand. Preparare, getting ready. So getting ready beforehand is even, there's like preparing to prepare. Getting ready to do the work you're going to do. And in golf, it's the tee up. It's the serve in tennis. It's the warm-up or the icebreaker in social interactions. I worked construction in college for an old master, veteran builder, really good mentor as well. And what he would tell me is, Til, don't rush into work. Don't try to get going before you've really taken time to set up. Get your ladders, get your tools ready, get your extension cords laid out, whatever, so that once your workspace and your work scene is prepared, then the day's going to go a lot smoother. You're going to do better work, safer overall. I worked for a while too as a corporate management consultant where we'd work with teams and manager-worker issues. Oftentimes the themes there were also in the rush for results or actions, the planning, aligning, the getting on the same page were skipped over, so taking time to actually sit back and have a conversation often helped these teams and managers work much more effectively together. Same is true in our hands-on work, really. Taking time to prepare on 3 levels is going to give us much more satisfying results. First level, prepare your workspace, the actual scenario you're going to work in. You want, of course, you want it to be clean, neat, warm, and welcoming. You also want it to convey a sense of what it is you're wanting to offer. Second, prepare yourself. Begin your work rested, groomed, fed, focused. Leave time to preview your notes, your plans, techniques you may want to employ, anatomy involved, essentially cognitive preparation for yourself. And then it's also preparing your mindset or emotional state or autonomic state. Use practices that help you find that receptivity, presence, adaptability that you're going to need to have in order to be there for your client and respond to what they bring. Third, of course, prepare your client and the rapport and the interactions you have with them. That really begins in your very first interactions with them. Even the texting interaction for setting up the scheduling, even your website, or whatever it is they first encounter you with is how you're preparing them for the work with you, how you're creating the conditions that are going to predispose great things to happen. You're going to communicate, of course, a sense of professionalism, of listening, clarity in your offer, and you're looking to create a sense of safety because that's what leaves them feeling receptive. That means that you care about what's important to them. You're going to take time to listen. You're going to find out, certainly in your initial interviews, maybe it's on the phone before they come, but even there at the beginning of each session, what do they want? What's motivating them? And how do they experience the disturbance or the problem or the thing that they're coming to you that they're wanting to change? Whether it's pain or performance or well-being, how is it that they exactly experience what's bothering them? Once you get a sense of that, how they experience it, then you can make your work much more relevant, and then you also have a benchmark to go back to and compare to see, did things actually change? We're learning a whole lot from placebo research, contextual effects research, rapport research, therapeutic alliance, how client expectations really do color the results they get. The biggest single factor for people getting better from back pain treatment is if they expect to get better. So we can really foster a sense of possibility, of openness. Sometimes it's a reality check. Sometimes it's saying, well, that's probably not realistic to expect from this work. But often it's helping people understand what they can hope for, what they can look for, even if it's shift and not elimination of symptoms. So creating those appropriate expectations is a huge part of the preparation as well. Now, there's also a role in preparation in closing up or wrapping up a session or a series, and that is getting people ready to end. It might be as simple as saying to your client, we have a couple of minutes left. Is there anything in particular that would help you feel complete for today? But somehow it's helping people prepare to stop with you. Complete for now is the catchword. So essentially, taking time to prepare will help make your work more efficient. Paradoxically, going slow in the beginning helps you go fast later. More effective because you can tune it to what your clients are hoping for, looking for, and experiencing. And more satisfying because the results you get and the time you spend doing it will be much better spent, much deeper and more meaningful to both you and your client. So check out the article in Massage and Bodywork or the chapters in Advanced Myofascial Techniques. Stay in touch. See you around.
So that when I heard that, I was like, wow, there's a different approach to why you work. Not just to fix somebody right away and then never see them again. And this kind of advanced work, it really allows you to work with somebody who's chronic, who's somebody who has got pain, has got a lot of issues, and you can constantly help them in, okay, knee surgery. I've had a knee surgery. How do I get back together? I ran out of the money that they only allowed me 12 sessions on my insurance, and I still can't walk properly. They come to us, and we're able to help because Til has shown us all these cool things.